8th.
Yeah, that's right. There's a lot of angles to this story. The feds have already sounded the alarm. The DEA administrator said that Xylazine, which is also this tranquilizer as it's known on the streets, it's made the country's deadliest drug problem, fentanyl, even deadlier. They found mixtures in 48 of 50 states coming across the southern border, they say, and here it's a problem. Police need a lot of help. The opioid crisis is escalating across Metro Detroit, and just one dose of Narcan administered by first responders to save an overdose victim is no longer enough like it was just a few years ago.
We saw that single dose administration of Narcan being effective. Now we're seeing it not be effective. It's requiring that second and third, and ultimately maybe 4 or 5 doses, whatever we have to combat that.
Farmington Hills Police Chief Jeff King is just one of many law enforcement officials across Oakland County working to get more resources into the hands of his officers in order to save more lives. But now that fentanyl is being mixed with the animal tranquilizer Xylazine, also known as Trank on the streets, making the fentanyl more deadly, there's an even bigger problem.
As bad as fentanyl is, Xylazine is another level, and there's nothing to counteract that. Like our officers do not have the medical grade counteracting agents for Xylazine that we have for Narcan, with Narcan and fentanyl and the opioids.
Law enforcement is hopeful the medical community can come up with an answer there ASAP. More and more drug enforcement teams throughout the area say they're finding fentanyl in cocaine, marijuana, and in pressed pill form. The mixture into weed is how Mary DePaulo's brother Gordon died in March of 2020. This is a picture of him at age 50, 7 years before he passed away.
When I went into his room, I was just shocked at the condition there. It was clear that he was actively using. The paraphernalia was on the dresser. It was just a terrible situation to walk into.
She works as a limited licensed psychologist helping people battling addiction get the help they need in a time when the need has reached crisis levels.
There are excellent addictionologists, doctors who specialize in addiction medicine who are local to our area. If you don't want to go to a rehab, you don't want to go to Brighton Hospital, you don't want to go to St. Mary's, yeah, you can actually get help by going outpatient to an addictionologist. Get all the medication you need to help you through your withdrawal symptoms.
But to get clean, she says, you have to really want it.
You give them the hand up. They need to do the work in order to live their life on the sober path. And it is possible. I've seen the miracles happen.
Well, the feds say that people who ingest any form, any mixture of Xylazine can face serious wounds and also the decay of tissue, human tissue, rotting of human tissue. Meantime, the Alliance of Coalitions for Healthy Communities, they have been working really around the clock to try to get out save-a-life stations, putting them in libraries, fire stations. These are literally boxes you can open up, kind of like those old newspaper dispensers. You can get cases of Narcan, and you can also get trained to save a life if you see somebody suffering from an opioid addiction overdose. Reporting live in Detroit, Dave Kinchin, Fox 2 News.
And Dave, I know you did that story just last week on these special kits that I know in West Bloomfield they're using and other communities as well. And they have fentanyl strips in those kits. I'd imagine the addition of this tranquilizer challenges how effective those efforts can be.
Yeah, it really does. Police certainly welcome those efforts, getting that help to the community and really training regular people to be able to administer help at any particular time. But certainly they need a lot more help, certainly from the federal level, state level, all around.